I rise today on an important gathering that's taking place at 9:30 this morning. It's a gathering of over 43 agencies and organizations that have come to us to inform us that they want Iowa to accept the federal money for the increase to access for health care through Medicaid. This bipartisan group of agencies and organizations are doctors and nurses, health care providers, advocates for patients, and patients themselves. These organizations represent the people who have leukemia, who have autism, epilepsy, diabetes, heart disease, cancer. These are agencies that in the very first time that have come together as stakeholders and as advocates to tell us that we should take advantage of the opportunity to increase the access to health care through Medicaid. These are the same groups of advocates and stakeholders who have been involved with us for the past 6 years on Iowa's health care reform. They know better than we do that hardworking Iowans need the security of affordable health care so they can start new businesses and not fear the loss of health care if they lose their job. Ensure that their kids are successful and that their parents can stay in their homes for as long as they can. They know Iowa thrives when we create shared prosperity, strengthen working families, and treat all people with dignity and respect. They are telling us the access to secure, affordable health care means that working families and small businesses helps families grow, businesses to remain strong, and our communities to be robust, and more importantly, that our kids could have a bright future. They are telling us that Medicaid covers our parents and grandparents when they are ill and need to go to a nursing home. They are telling us that Iowans who are disabled will be able to live independently as long as they can through Medicaid. And they are telling us that every child, every kid in this state, if they need to go to a doctor, can go to a doctor. They are telling us Medicaid means that hardworking people don't have to worry about falling through the coverage gap. They are telling us that emergency rooms is no place for primary care, that emergency rooms are for people who have real emergencies but don't need to go there just because they're sick, that it's a waste of money and it's inefficient, and it holds up and slows down the process of people who really do need emergency care. In this state, close to $1 billion in charity care goes to patients that through the increased access to Medicaid could get regular care instead, protect their families and themselves. Perhaps most importantly, this bipartisan group of advocates who have come to the Capitol today telling us to accept the federal money to increase access to health care. Madam President, this is a time for us to listen to our constituents from across the state and across the political spectrum. It's time for us to put away our political differences and to cast aside those differences so we can begin a dialogue with Iowans. Madam President, today Democrats have introduced a bill that will start that dialogue. Now, it's not a perfect bill. We need your help. We need Republicans to start that dialogue with us. We know because of the political environment, you are suspicious of what the increase of Medicaid will mean for Iowa. We're asking you to put away those political differences for a moment, to open up your mind and to listen to the constituents that are gathered here today. Because by increasing Medicaid, we will be able to bring health care to 150,000 more Iowans. That means in our districts, every one of us will be able to provide health care to 3,000 Iowans. And I dare say you know many of them. Imagine going to Friday night football and looking in the stands. Many of those football games gather 3,000 or more Iowans to watch kids play football. Look in the stands next time you're there, or imagine the last game you went to. Those are the number of Iowans that we will be able to help now, in real time. And so the constituents today are here to tell us that message. So at 9:30, I'm sure everyone is welcome. Go down there and talk to them. Ask them why are they doing this. Engage them in the questions that you have. This is not about the possibility of raising taxes, or the possibility of providing more money for roads, or the possibility of increasing economic development for any in particular group of industries. This is about helping our neighbors. So, Madam President, I engage the Senate beginning today to engage our Iowans and our constituents in a dialogue of increasing Medicaid to all Iowans across the state that are eligible. Thank you.